Hi everyone, I am Dr. Andi. It is time for today's Facebook Live. While I give all of you the opportunity to join and log on, I'm going to give a brief introduction into who I am and a little bit about my background. So I am a naturopathic physician. I have been practicing for 12 years in Toronto, Canada. It always seems like a long time every time I say that. My focus and sort of background in practice comes or sort of stems from the low-carb keto standpoint. In my practice, my focus used to be more so on sports medicine, and then I eventually transitioned more into metabolic nutrition, fat loss, weight loss, hormonal balance, and we also have a really big focus on chronic illness like Lyme disease, chronic fatigue, fibromyalgia, as well as cognitive function, reversing and preventing cognitive decline. At the foundation of our protocols or of our practice is really using that low-carb keto standpoint. So obviously from a ketogenic diet standpoint, when we're treating chronic illness, that was a really important thing for us. And then being able to incorporate beta-hydroxybutyrate in those patients who either want to optimize their keto diet or actually couldn't or weren't able to follow a ketogenic diet was really quite helpful. I had been asked a few questions on the last call about cognition and cognitive function that I wasn't quite able to get to. So I wanted to start the call today by answering some of those questions. Like I said, one of our primary focuses in practice is cognition, cognitive function, so reversing and preventing cognitive decline. We work with a lot of Alzheimer's patients or people who are just looking to optimize mental focus, mental clarity. So we do get quite a few questions about whether or not beta-hydroxybutyrate plays a role there or not. So there's some really interesting research looking at the role that beta-hydroxybutyrate can play with respect to cognitive function, and I will touch a little bit on ADD, ADHD, epilepsy. I also got that question last time and I missed it. So I'll touch a little bit on that as well. So beta-hydroxybutyrate has actually been shown in animal and now in human trials to be effective or helpful in terms of those who are experiencing cognitive decline. Specifically when we look at something called BDNF. So BDNF stands for brain-derived neurotrophic factor. And BDNF is something that we see quite low in our patients, or it's highly correlated to cognitive function. So it stands for, again, brain-derived neurotrophic factor. So that's what we need to create new neuronal connections, new neuronal pathways in the brain. And beta-hydroxybutyrate has been shown to upregulate this BDNF. Interestingly, fasting has been shown to do that as well. So intermittent fasting or the extended fasting like a reboot has also been shown to upregulate BDNF. The other thing about BDNF is it's also shown to be low in those who suffer from autoimmune conditions. So fibromyalgia, also chronic fatigue, we see low BDNF. So there is a role. So that's usually a foundation of my practice, is getting beta-hydroxybutyrate into those patients. And if you're a Lyme patient or chronic illness patient, I'm also making you go keto and introducing some intermittent fasting as well, so we can really upregulate that BDNF and optimize cognitive function overall. So there's some really interesting research in that space. And the other area that we get a lot of questions is ADHD, and what they have found is, and actually before I go to ADHD, I can see there's a question about dementia and drinking ketones. So you have a customer's husband who has dementia. Should he be drinking 2 doses a day? So my answer to that is yes. Obviously, he has to work with his healthcare provider, find out what they say is safe for him. But when there's a therapeutic outcome that I'm looking for from my patients, that's often when I'll recommend a higher dose or higher serving of ketones, because we want that BHB in the system for a longer period of time. So we might not necessarily have, so when people are starting, I may ask them to start just with 1 sachet in the morning, see how they feel, and slowly sort of work around it and find out what works best for them. But when there's a therapeutic outcome that I'm looking for, then if the person's not keto, after a few hours, they don't have beta-hydroxybutyrate in their system anymore. So if we're looking for BHB to have a specific outcome, or you're trying to address something specific, then you're going to want to have it more frequently to make sure it's in your system for longer. So in those instances, yes, I'm having my patients, I'm always having my patients take more than 1 serving a day. 2, I've had some instances of patients where I've had them take even 3 servings a day. But 2, I think, is a good place to start. I know taking 3 can be a little bit much for some people, so starting at 2 is fine. maybe in the morning, and then sometime mid-evening, obviously just caffeine free if you're taking that second serving in the day. So yes, I would suggest another serving just to really optimize the outcome that you're looking for. But of course, they have to talk to their healthcare provider, make sure that they say that that's safe for them. So coming back to the ADHD and the epilepsy connection, we get quite a few questions from ADHD. And could there be benefit? Why would we see benefit? So I usually recommend, especially if the question is in children, I recommend people check out the Chartley Foundation. They have a lot of information about ketones, ketogenic diet, BHB with respect to ADHD. But what they've actually found in those who suffer from ADHD is that their brain waves are very similar to the brain waves of someone who suffers from epilepsy. And they suspect that that's why we see benefit when we have ketones or beta-hydroxybutyrate in our system, because we know the ketogenic diet was created by a neurologist to treat seizures in children with epilepsy. And they're finding that ADHD, they have similar brain waves. So that's why we suspect we see some benefit. So I would absolutely recommend that you work with your healthcare provider. Make sure they say that that's safe for you. But there's some great research in that space showing that the benefit that beta-hydroxybutyrate can have with respect to cognition. If muscle gain is the goal, is pro recommended in lieu of NAT? So I wouldn't say you have to do one over the other. I would say it depends on how often you're having them in a day. So for example, if you're having 2 servings in a day, then I actually like to alternate. So you don't necessarily have to only take the pro, maybe do 1 NAT and then take 1 pro after your workout. Or before if you're using it as a fuel for your workout as well. So you don't have to stick with one in particular. If muscle building is your goal and you want that extra protein and you only want to do it once a day, then yes, that's the one that I would take. But otherwise, I usually recommend taking it twice a day in those instances. And then I would play around with it. You can use the NAT and then you can use the pro as well. So you had surgery for diverticulitis. When can you start drinking your ketones? You have to talk to your doctor about that. Only because post-surgery, a lot of patients with diverticulitis wonder if they can take ketones. So yes, they're generally safe. You have to talk to your doctor, but post-surgery, you have to wait for your specialist and for your surgeon to tell you when it's safe for you to start reintroducing your supplements and your nutraceuticals. And then when they say it's safe, usually a week is long enough. But again, only you and your surgeon know how the surgery went. Did you have complications? Anything else from a health standpoint that you're addressing? So you have to wait until your surgeon has cleared you to start taking supplements again. And once they do that, then yes, you can start taking your ketones again. Do ketones break your fast? So that's a great question. So in general, what we're doing when we're fasting is we're trying to turn on this process called autophagy or autophagy. And essentially that's a process where you clear out dead, damaged cells that aren't doing what they're supposed to be doing, and it allows us to create new healthy cells. It's sort of a metabolic reset, an inflammatory reset. So what they're finding, because we have years and years of research with respect to fasting, people have done this for religious purposes for so many years. We have a lot of research when it comes to fasting and extended fasting. And what they're now starting to suspect is that the benefits that we see from fasting are due to the production of ketone bodies. And again, it can take a while to get into ketosis, obviously, if you're just using fasting and not using a ketogenic diet, but they're finding that it's the production of those ketone bodies that are really causing some of that benefit. And we now also know that beta-hydroxybutyrate can also stimulate autophagy, not just fasting. So I have my patients take their ketones in their fasting window. I have no problem with that. And the reason for that is because I'm trying to optimize what we're doing in that fasting window, which is turning on that autophagy process. So beta-hydroxybutyrate can work quite well. It's very synergistic with fasting. And so I'm fine with my patients taking their ketones in that fasting window. I don't have a problem with that. The concern when we sort of break the fast is the insulin spike, and our insulin is generally spiked through glucose. And so if we consume glucose, we spike our insulin, and insulin shuts off autophagy. So it doesn't allow that process to happen as it's supposed to. But again, in that fasting window, we're adding in beta-hydroxybutyrate. I'm fine with that because we're optimizing what we're trying to do in that fasting window anyway. For people who are concerned, some people just don't want to take anything, then I usually tell them just to end their fast or break their fast with their ketones or their keto cream. and just end your fast. Keto cream, technically, I'll sometimes have patients do that at the end of the fasting window as well, but I will let them take their NAT or something like that in the fasting window, and I don't have any concerns. So customer's husband, would he still get energy and brain benefit if he refuses to give up his sweets? That's a great question. So it's a good question, because I always like to remind people that we can't out supplement a bad diet. It's not possible to do that. And supplementation can't erase our sort of poor food choices. We can make up for it as best we can. And we can do things to try and mitigate the effects of some of those things. But it's always important to remember that what we put in our body does matter. However, that said, yes, you will still get the benefits of beta-hydroxybutyrate, even if you haven't changed your diet, even if you're still eating, all the sweets and things like that. That is one of the sort of the key benefits of beta-hydroxybutyrate, is that it allows you to experience being in nutritional ketosis even when you haven't made a diet change. And this is now the first time, or the first opportunity, where we've been able to present the body with fats and with ketones at the same time and figure out which fuel source the body prefers. And so what we're actually finding is that when we look at things like brain, heart, muscle, some of those are actually preferring ketones over glucose when given the option of both. So the brain or the heart or muscles will actually uptake the ketones. So you will still make use of beta-hydroxybutyrate even if there's glucose in your system. Even if you haven't changed your diet, you will still get benefit of having the BHB there. You will still have benefit of the BHB there, but of course, what study shows that when you make the dietary changes, obviously those effects are amplified. So do you have to make the dietary changes? No. As a doctor, I'm going to tell you to make those anyway. It's very important just to your overall health, but no, you don't have to. And yes, you will still get the benefit even if you haven't made those changes. You'll just get even greater benefit if you do make those lifestyle changes with it. How many Mito Plex packets are ideal for one day? Some drink them separately or always with the NAT. So you can drink your Mito Plex separately, and I would say it depends on your need in terms of how many you need to take in a day. So if you're extremely active, if you're exercising, working out, things like that, then yes, I would recommend taking the Mito Plex probably more than once a day, maybe twice a day. I usually encourage just putting them right in with your ketones. It's easy. You're already mixing a drink, so you just put them right in. But if you're only having your ketones once a day and you need another serving, then you can just mix it with whatever you like. It doesn't have to be in with your NAT or anything like that. You can separate them, but I find it's just easier when you mix it all together. And once a day is fine, but if you think your need is a little bit higher, you're an athlete, endurance exercise, whatever the case might be, then yes, you probably want to add in a little bit more. What are your recommendations for breaking a 5-day fast? So when you do extended fasting like that, when you break the fast, you do have to be, a little bit careful in terms of what the kind of foods that you choose when you opt to break the fast after 5 days. So usually, again, it depends on what kind of fast you've done. If you were just doing a water fast, then I'm having people start by broth. Just bone broth is the first way that I'm having them break the fast. And then I want them to break it. I don't want you to just sort of eat whatever you want. The fast is over and you just kind of jump in and you're eating a burger. But no, so I want really foods that are really gentle on the gut, high fat foods. So usually I'll have people start with a little bit of broth and then something like eggs, some avocado, things that are just really gentle and easy to digest, small meals, small portion sizes, and then just eating those small meals and portion sizes throughout the day. Lots of liquids and broths and soups are really good as well, nourishing soups. That's usually how I have people break it on the first day and then transition into the larger meals. You don't want to overwhelm your system by having a massive meal and making it full of, carbs and things like that. You will not feel well. So you just have to be really gentle on your gut. And again, using things like the broths and the soups and then introducing the eggs, avocado, things like that are a good start, and then slowly moving up to those larger meals. But that's usually how I have people transition. Again, depends on the type of fast you were doing. Some people were take supplements during a 5-day fast. Some people are drinking broth during the fast. So it just depends if you're doing a water fast or not. But if you were just doing a water fast, then introducing the broth first, and that's how I would encourage people to start. Will Mito Plex break a fast? No, it won't break a fast. So you can do the Mito Plex in the morning with your ketones for sure. I don't have a gallbladder. Can I still take this and lose weight? And should I take other supplements? So yes, whether or not you have a gallbladder won't impact whether or not you can take ketones. The concern is more when the gallbladder is not there. The concern is more so about following a ketogenic diet. So when you've had your gallbladder removed, your abilities to break down fat is impaired, essentially. Anyone who has had their gallbladder out, no matter what kind of diet they're on, needs to take ox bile. So you can either take ox bile on its own, or you can take a digestive enzyme with ox bile, but that's something that you have to be taking when you've had your gallbladder removed. Some people are asked to follow a low-fat diet. I never ask my patients to follow a low-fat diet. It's the last kind of diet I want them to follow. We need fats to make hormones. All of our cells, our brain, they all need fat. So I'm never encouraging my patients to follow a low-fat diet. If your gallbladder is out, you're going to be on ox bile forever to replace the function. So you do need to transition to ox bile so you can digest fats. But from a supplementation standpoint, taking your NAT, beta-hydroxybutyrate doesn't make a difference if you have a gallbladder or not. The gallbladder is not really involved in that process, and the same thing goes with MCT oil. So even though you have challenges digesting most fats, the MCT fats are not a problem either. So even if you're not taking the ox bile, you'll still be able to digest those things quite well. But again, I recommend obviously taking the ox bile, taking your digestive enzyme, but either way you'll be fine with the ketones. Can you get the keto rash taking NAT and eating carbs? If so, what is needed to prevent it? So some people have, very rarely have I seen people get a keto rash or keto flu if they're still eating carbs. But there are supplements I have patients take when we start taking ketones, and also even when we start taking ketones or following a ketogenic diet. So preventing the rash, and I can say I've never really had a patient come in with a keto rash as long as you're supplementing effectively. Essentially, when you transition to a keto diet, we know it can act as a bit of a diuretic. So the things I'm having my patients take when they go keto or start taking their ketones, magnesium before bed, I'm having them take a multivitamin, a B complex, and electrolytes. And so that's sort of a foundation kind of across the board. That's what everybody is taking as soon as we're making that transition, and that pretty effectively prevents or treats the keto rash. So it's usually a sign of just some vitamin nutrient deficiencies or mineral deficiency. So again, add in your multi, your B complex, your magnesium, and your electrolytes. So those are the things that you need to ask to prevent that. But it's not likely you'll get a keto flu when you start taking ketones and you're still eating carbs. But if you do, then those are some of the things that you'd like to add in. I run almost every day. You find that you're dehydrated. If you start doing 2 Mito Plex a day and use that with the NAT, will that help? Yes, that will help for sure. If you're finding you're feeling a little bit dehydrated, then absolutely have it twice a day for sure. Do probiotics help with the keto rash? I don't find that, so probiotics in and of themselves are fantastic, but I don't find that it's the probiotics specifically that help with the keto rash. So yes, I think it's important to take a probiotic when necessarily, especially if there's some kind of gut dysfunction. But from a preventative standpoint, preventing somebody from getting the keto rash, then no. Probiotics isn't sort of on the list of those preventative things, but overall and in general, yes, taking a probiotic is great. So I would feel free to add that in. Am I saying, so ox bile. Okay, so what am I saying if you don't have a gallbladder? I'm saying ox bile. So ox is O-X, and then bile, B-I-L-E. So you can look for a digestive enzyme with ox bile or just ox bile on its own, and you can just supplement with that by itself. So that's what I would recommend. How many grams per day should you consume of macros for fat and protein? So this is where I would really start working with somebody depending on your goals. So the average goal in terms of our macros for fat, carbs, and protein. For carbs, it's usually less than 10%, proteins around 20, fats are around 70. That's kind of the standard keto. I rarely have a patient who's on 70% fat. That's quite high. And if the goal is fat loss, then that's probably too high. And so then you need to cut the fats down a little more. So the macros are very different. And then the same goes for carbohydrates. So for example, if you're an athlete and you're training extensively, you can actually probably have more carbs in a day. So often you need to have fewer than 20 grams of carbohydrates in a day just to get into ketosis, and then you kind of stick around 20 to 30 grams of carbs. But athletes, for example, can sometimes have 50, 100 grams, depending on how active they are. So when it comes to calculating the macros, it is really specific. As a general rule for sort of the non-athletes, it also depends on how strict you want to be. Do you actually want to be measuring blood ketones? Do you want to be tracking your food? So it depends on what your goals are, how strict you're willing to be, and what you're willing to do. I don't often make people track food long-term, maybe a week just to get a sense of what you're eating, or if we've hit a weight loss plateau, then I'll have someone track their food just so I can get a breakdown of carb, fat, and protein. But overall, what I'll often have people to do as a very easy start is introduce intermittent fasting, 16 hours. You have 2 meals left in a day, only 1 meal can contain a carbohydrate. Try and reduce the grains. That's sort of my, standard simple approach. But if you really want to break it down, then you need to start tracking your food, and then you need to start measuring your ketones. If fat loss is your goal, you probably want to lower the fat to maybe 50 or 60, and then up the protein a little bit. And then you probably want to start, after about 6 weeks, that's when you'll start measuring blood ketones. So again, it's very specific. Everyone is individual. Everyone is coming from a different metabolic state. So I would say use that easy transition to start start tracking your food. In about 6 weeks, start checking your blood ketone levels, and then start making adjustments as needed. Again, if you're very active, some people can have more carbohydrates. If you're trying to lose weight, then we want to drop the fat content. You don't want too much fat. So it is a little bit different for everybody. As a general rule, I'll often say like 60% fat and 10% carbs in the diet is sort of a good standard. But it's very individualized. So you have to see what works for you. So I would start checking your blood ketones and sort of follow those few steps. And then see if that sort of gets you where you want to be. But again, it also has to, it depends on what your goals are. Does ox bile help with a colon delay? So I'm assuming that you're meaning constipation. So it's sort of like a slower transit time. It can help with constipation, but really at the end of the day, what you're trying to figure out is why you're experiencing that in the first place. Are you dehydrated? Are you mineral deficient? Do you need to add some magnesium? Do you have SIBO going on? So small intestine bacterial overgrowth that needs to be treated. Do food sensitivities? So you really have to find out what's causing it. So ox bile, yes, can help with digestion and transit time. Sometimes people need a prokinetic and they need something like LDN or something just to help sort of teach the colon how to contract again. So sometimes there are different things that need to be involved. So it just depends on your health, where you're coming from, and how you need to intervene in that space. But that's a good place to start with the ox bile. Magnesium is a really safe and easy way to make sure that you're eliminating regularly. That's usually the first go-to. It's quite simple. And every night, so I usually have patients take 1 capsule per night, and then you increase by a capsule per night until you have a normal bowel movement the next day. So that's usually how, and then find the dose that works for you, and that's your dose. Whether that's 500 milligrams, 800 milligrams, 200 milligrams, you just have to find the dose, and that's usually the easiest way to do that. But obviously, if you have gut problems, then find a functional medicine provider to help you so you can figure out what's at the root of that, and so that you can actually start treating them. Why can't I take ketones? They make me feel sick. I throw up. They won't stay down, and you feel dizzy. Okay, so first thing is I would mix your ketones with Mito Plex, so put some electrolytes in there. The second thing is that I would don't take them on an empty stomach. So have, some eggs or some avocado or something like that. Make sure you've got some food in your system. And then reduce the serving. So maybe start with 1/4 of a sachet or a 1/2 a sachet and see if that makes a difference for you. It is also important to remember that at the end of the day, anyone can be sensitive to anything. We have people who are allergic to bananas or to avocado, and sometimes there are just things that don't agree with our system. So we also have to acknowledge if there's something that maybe we're just not able to take. If you're having sort of an allergic reaction or a sensitivity or something like that. So I would try first with reducing the serving size, adding your Mito Plex, and taking it after some food and see how you feel. And then also having, and then try to figure out from there, are you having some kind of allergic response or sensitivity to an ingredient? Because again, we can be sensitive and allergic to anything. I deal with a lot of chronically ill patients. I have patients who feel sick after they drink water. So things that 95% of the population tolerate well, there are some people who just don't. So it's important to just remember that we're all different. And so acknowledging that some things sit well with one person and not with another. So try a few of those other strategies and see if that makes a difference. Usually that's all it takes. Is just adding a little bit of food, reducing the serving, allowing your digestive tract to sort of adjust and adapt, and then slowly increasing from there. That's usually all you need. Is the efficacy of ketones impacted when you mix it with other liquids like juice? No, you can mix it with juice, mix it with water. I like to put it in sparkling water, although be careful because it will sort of like fizz and bubble over. I learned that the hard way the first time. So no, you can mix it with other types of beverages. That's not a problem at all. Can you mix it in coffee? Yes, you can put it in your coffee as well, although I'm not sure about the taste of that for you, but yes, you can do that. What ketone can you drink fast? So do you mean like which one can you consume quickly? I'm not sure. Sorry, if you could clarify that question and then I'll try and answer that again. Because sometimes you want to drink them more quickly. So if what you're saying is you just want to drink it quickly and you're wanting to have your nat, you can just mix it in smaller amounts of water. It doesn't have to be in a whole shaker cup. I mix mine in just a small glass of water. I don't mix it in a whole shaker cup. I put it in a small glass of water and use a little hand mixer and a frother, and then I just drink it down. That way I just get it in quickly and I don't have to worry about consuming a whole jug of water that I might not finish in time. So you can just mix it, in a smaller amount of water and drink it a bit more quickly as well. What are your thoughts on eating fruit on a low carb lifestyle? I have no problem with that. There are a lot of myths about the ketogenic lifestyle and low carb lifestyle, this idea that you can't eat fruit, you can't eat anything, and it's not true. You can absolutely eat fruit. It's all about managing how much you consume in a day, that's all. So if you want low glycemic fruit, you can do things like berries and raspberries. You can do half a cup of berries in a day. You can still have fruit. It's not about eliminating all of these things that you love. It's just about modifying how much of those things you consume. So you can absolutely have fruit on a low carb diet. That's not a problem. And I've seen a lot of people post things like, I'll never follow a diet that tells me to cut out all of my, tells me I can't eat fruit. Well, you can eat fruit. So I wouldn't be too concerned about that. So you can absolutely do that. What about a person who has anxiety and is afraid to try ketones? For someone who has anxiety and doesn't want to try them, really you have to find out what it is that's holding them back, why they don't want to try it. Often there's just a little bit of miscommunication, misunderstanding. They've been, miseducated, or they've read something online or on social. They don't really understand what it is. So often that's usually more about education, just educating them about what it is, how to take them, what it's doing. And that usually solves that problem, is just making sure they have a better understanding of what it is that they're doing, because a lot of people are a little bit concerned about that. So that is all of our time today, everyone. That flew by. So I will log, like I said, I always go through the questions. I try and answer them. If I miss them, I'll tag them on to our next live next week. So thank you all for joining today. I hope I got to most of your questions. So enjoy your week, everybody, and stay safe and healthy.